Cardiovascular diseases, or CVDs, are a major health concern, affecting millions of adults worldwide. These diseases are often referred to as the silent killers because they can develop over many years without noticeable symptoms. By the time symptoms do appear, the disease may have already caused significant damage. These diseases involve the heart and blood vessels, which are crucial for delivering oxygen and nutrients throughout the body. The heart, being the central organ of our circulatory system, pumps blood through a network of arteries and veins. Any disruption in this system can lead to severe health issues. CVDs are particularly prevalent in adults over 40, often leading to serious health complications and even death. Conditions such as coronary artery disease, heart attacks, and strokes are common manifestations of CVDs. These conditions can drastically reduce the quality of life and increase the risk of mortality. As we age, our risk of developing CVDs increases. This is due to the natural wear and tear on our cardiovascular system over time. Plaque buildup in the arteries, high blood pressure, and other age-related changes contribute to this increased risk. This is due to a combination of factors including lifestyle choices, genetics, and the natural aging process. Poor diet, lack of exercise, smoking, and excessive alcohol consumption are significant lifestyle factors that can increase the risk of CVDs. Genetics also play a role, as a family history of heart disease can predispose individuals to similar conditions. However, it's important to remember that CVDs can affect anyone, regardless of age. Even young adults and children can be at risk if they have underlying health conditions or poor lifestyle habits. Therefore, it's crucial for everyone to be aware of their heart health and take preventive measures. The good news is that many CVDs are preventable and treatable, especially when detected early. Regular checkups, maintaining a healthy diet, exercising regularly, and avoiding smoking can significantly reduce the risk of developing cardiovascular diseases. Early detection through screenings and monitoring can lead to more effective treatments and better outcomes. By understanding the causes, symptoms, and risk factors associated with these diseases, we can take proactive steps to protect our heart health and live longer, healthier lives. Educating ourselves and our communities about heart health can lead to a more informed and healthier population. Remember, knowledge is power when it comes to CVDs. The more we know, the better equipped we are to take action and make positive changes in our lives. Let's commit to learning more about cardiovascular health and spreading awareness to help reduce the impact of these silent threats. While CVDs are more common in adults over 40, their development often begins much earlier in life. In fact, some CVDs can start developing in childhood or adolescence, silently progressing for decades before any noticeable symptoms appear. This highlights the importance of early detection and prevention. Even if you're young and healthy, it's crucial to be aware of your heart health and take steps to reduce your risk factors. Factors like family history, unhealthy diet, lack of exercise, and smoking can all contribute to the early development of CVDs. By addressing these factors early on, we can significantly reduce the likelihood of serious heart problems later in life. Early detection is key to effectively managing and treating CVDs. Regular medical checkups, even when you feel healthy, are crucial for identifying potential problems before they become serious. Several diagnostic tests can help assess your heart health. Electrocardiograms, or ECGs, measure your heart's electrical activity, detecting irregularities in heart rhythm. Blood pressure monitoring tracks the force of blood against your artery walls, revealing potential issues with blood flow. Blood tests can also provide valuable insights into your cardiovascular health. These tests measure cholesterol levels, blood sugar levels, and other markers that can indicate an increased risk of CVDs. Understanding the causes of CVDs is crucial for prevention and treatment. Several factors contribute to their development, some within our control and others not. Genetics play a role in determining our predisposition to certain heart conditions. If you have a family history of CVDs, you may be at higher risk. However, genetics don't dictate your destiny. Lifestyle choices have a significant impact on heart health. Smoking, lack of physical activity, an unhealthy diet high in saturated and trans fats, and excessive alcohol consumption are all major risk factors for CVDs. Stress, both chronic and acute, can also take a toll on your heart. Learning effective stress management techniques such as meditation, yoga, or deep breathing exercises can help protect your heart health. Section 5. Atheromatosis, the silent constrictor. Atheromatosis, a major contributor to cardiovascular diseases, is Well, a gradual process that often begins in childhood. It involves the buildup of plaque on the inner walls of arteries, the blood vessels responsible for carrying oxygen-rich blood throughout the body. This plaque, composed of cholesterol, fats, and other substances, hardens over time, narrowing the arteries and restricting blood flow. This process, known as atherosclerosis, can affect arteries throughout the body, including those supplying the heart, brain, and legs. As the arteries narrow, the heart has to work harder to pump blood, putting extra strain on the cardiovascular system. This can lead to a variety of problems, including high blood pressure, chest pain, also known as angina, and even heart attack or stroke. Section 6. Ischemic heart disease. When the heart lacks nourishment. Ischemic heart disease, also known as coronary artery disease, occurs when the arteries supplying blood to the heart muscle become narrowed or blocked due to atherosclerosis. This condition is a leading cause of death worldwide, affecting millions of people each year. The buildup of plaque, which consists of fat, cholesterol, and other substances, can lead to significant health issues if not managed properly. This restriction of blood flow, known as ischemia, deprives the heart of oxygen and nutrients, leading to various symptoms and complications. When the heart muscle doesn't get enough oxygen, it struggles to function effectively, which can result in severe consequences if left untreated. Chest pain, often described as tightness, pressure, or a squeezing sensation, is a common symptom of ischemic heart disease. This pain, known as angina, can be a warning sign that the heart is not receiving enough blood flow. Angina can vary in intensity and duration, sometimes lasting just a few minutes or persisting for longer periods. This pain, known as angina, typically occurs during physical activity or emotional stress when the heart demands more oxygen. Activities such as climbing stairs, walking briskly, or even experiencing strong emotions can trigger angina. It's crucial to recognize these triggers and manage them effectively to prevent further complications. Other symptoms of ischemic heart disease can include shortness of breath, fatigue, nausea, and pain radiating to the arms, jaw, neck, or back. These symptoms can significantly impact a person's quality of life, making everyday activities challenging and sometimes unbearable. The severity of symptoms can vary depending on the extent of artery blockage and the overall health of the individual. Early detection and management are key to preventing the progression of ischemic heart disease. Regular checkups, a healthy diet, exercise, and medications can help manage the condition and improve the quality of life for those affected. Section 7. Myocardial infarction, a race against time. Myocardial infarction, commonly known as a heart attack, is a life-threatening condition that occurs when blood flow to a part of the heart muscle is completely blocked, usually by a blood clot forming in a narrowed coronary artery. This blockage prevents oxygen-rich blood from reaching the heart muscle, leading to tissue damage and potentially death. Symptoms of a heart attack can vary, but common signs include intense chest pain that may radiate to the arms, jaw, neck, or back, shortness of breath, sweating, nausea, vomiting, and a feeling of impending doom. Time is of the essence when it comes to treating a heart attack. Seeking immediate medical attention is crucial for minimizing damage to the heart muscle and improving chances of survival. Section 8. Cardiac rheumatism, a hidden threat to young hearts. Cardiac rheumatism, also known as rheumatic heart disease, is a condition that can develop after an untreated or inadequately treated strep throat infection, typically caused by group A streptococcus bacteria. This condition primarily affects the heart valves, causing inflammation and damage that can lead to heart valve dysfunction and heart failure. While less common in developed countries due to improved hygiene and access to antibiotics, cardiac rheumatism remains a significant health concern in developing nations. Symptoms of cardiac rheumatism can be subtle and easily missed, especially in children. Fatigue, shortness of breath, chest pain, and irregular heartbeat are some common signs. Early detection and treatment with antibiotics are crucial for preventing long-term heart damage. Section 9. Chronic heart failure, a cascade of complications. Chronic heart failure, a serious condition that develops over time, occurs when the heart muscle becomes weakened and unable to pump blood effectively to meet the body's needs. This condition can significantly impact a person's daily life, making even simple activities feel like monumental tasks. This can result from various factors, including coronary artery disease, high blood pressure, heart valve problems, and certain viral infections. Each of these factors can contribute to the gradual weakening of the heart muscle, leading to the onset of chronic heart failure. As the heart's pumping ability declines, blood can back up into the lungs and other parts of the body, leading to a range of symptoms such as shortness of breath, which can make breathing feel labored and difficult, especially during physical activity. Fatigue, which can leave individuals feeling constantly tired and drained, even after a full night's sleep. Swelling in the legs and ankles, known as edema, which occurs when fluid builds up in the body's tissues, and rapid weight gain, which can be a sign of fluid retention. Chronic heart failure is a progressive condition, meaning it tends to worsen over time. As the disease advances, symptoms can become more severe and frequent, further impacting the quality of life. While there is no cure, various treatments can help manage symptoms, slow disease progression, and improve quality of life. These treatments may include medications to help the heart pump more effectively, lifestyle changes such as a heart-healthy diet and regular exercise, and in some cases, surgical interventions. With proper management, individuals with chronic heart failure can lead fulfilling lives, finding ways to adapt and thrive despite the challenges posed by this condition.